Today, we are looking at data science's role in informing and driving public policy. We'll focus on its potential for real-world impact, where data analysis and sound decision-making can truly save lives and livelihoods. Things will get very interesting when we closely examine social problems that have been altered and even exacerbated by the pandemic, especially the areas of public safety, juvenile justice, child welfare, and education. Please join me, audience and viewers, in welcoming today's guests. We have Dana Weiner with us, who is Senior Policy Fellow at Chapin Hall at the University of Chicago, and Max Kapustin, who is Assistant Professor at the Department of Policy Analysis and Management at Cornell University. Today's keynote is brought to you by eCornell in partnership with Cornell's College of Human Ecology. And this event, I should note, viewers, is being recorded and will be available at this same URL afterwards. So if you have to leave or you want to share the URL with friends, take comfort in knowing that the recording will be available at the same URL moments after we're through. We'll just run a quick edit. It'll be available. A couple other quick programming notes. The live chat is available at the top right of your video player. So if you open that, we'll take your questions throughout. Also, heads up for a few links in expanded reading, courtesy of some links and resources that Dana and Max have left us or have provided for us. So take a look and make sure to check out some of the links that will augment some of the conversation that's happening today. For those of you who work in the data science space or aspire to, we'll also be sharing a link to the full suite of data science certificate programs and courses offered by Cornell University at ecornell.com. So welcome, Max and Dana. So lovely to have you in here. I'm so excited that we're kicking this off finally. Dana Weiner, tell us a little bit about what's involved in data-driven policy making.
Sure, and thanks for having us today.
Yeah.
So data-driven policy making refers to using data and information and evidence to inform the big decisions that systems have to make. And so on this first slide, you'll see just a few of the areas, and I'm certain there are others, in which we use data-driven, and the slide just changed. Let's go back to the one that we were just on, slide 6. There we are. So these are just some of the areas that in which we use data to drive policy. Transparency, meaning making it clear how we make decisions about who gets what services. Accountability, holding agencies accountable to the things that they say they will deliver and ensuring that things are delivered the way they should be. Responsiveness, so making sure that the array of services is arranged in such a way that people can access it. And effectiveness, making sure that what we're doing works. And we care about those things at the individual level, but we also care about those things at the level of the whole system. So I have a concrete example for you, and I want to say a lot of what we do uses fancy math. So we do geographically weighted regression and predictive risk modeling, but a lot of what we do involves really simple stuff. So on the next slide, I brought just a concrete example of this. So when we want to see whether the services are arranged in a way that is aligned with what the population needs, we do simple maps. On this map, what you're looking at is a map of Illinois, and the blue shading is kids in need of trauma-informed care. The red circles are the providers who have evidence-based trauma-informed services. And you can see right away where you need more services, the areas where there's blue and there's no red. So that, we might approach this in a more sophisticated way and geographically optimize the exact right location, but really starting with a picture is the most concrete example of how we use data to drive policy.
Perfect example to kick off the conversation. So not being a fancy math guy myself, I'm curious about a few things. I mean, you both work at the confluence of several disciplines. You're in academia, policy analysis, data science, and where all those disciplines come together. Max Kapustin, tell us about your work. And I really want to know what it's like, your everyday, what animates you, what gets you jazzed about this particular work, and what the experience is like.
Sure, no, happy to. So I'm an assistant professor at the Department of Policy Analysis and Management at Cornell. And my research mostly focuses on ways of improving outcomes for especially disadvantaged families and individuals living in urban neighborhoods in the US. Of course, there are a lot of challenges facing that population, especially in this past year, as we saw all too clearly with COVID, and we'll talk about that more in a bit. But one challenge in particular that really animates me, the reason why I kind of get up in the morning to do this work, is actually what you're looking at here. which is this what I've termed here kind of the safety gap, if you will, between white and black men. I think this is just kind of a stark illustration of some of the really, really difficult challenges that cities in the US face. This figure here shows you the leading causes of death per 100,000. This is data from the Centers for Disease Control for both young white men and young black men aged 15 to 24. And one thing that I think should really stand out at you as you look at this is the experiences of white and black men are so radically different in the U.S. And this is one area where I'm hoping that research and data can really help to inform policy. The leading cause of death for young black men is by quite a ways homicide, and it's something like over 20 times the rate of their white counterparts. It's also, I think, larger than like the next 9 leading causes of death combined for black men. So this is a really difficult challenge that, again, a lot of cities struggle with in the U.S. And what really animates me is finding ways to use the tools that we developed in social science to try to make a difference in this gap in particular. That's at least why I get up every day in the morning.
Yeah, exactly. So you've identified the problem. I mean, how do you then turn around and apply the data that you work very intimately with, and all the evidentiary content and all that stuff to actually address a challenge like this? What happens, right? So once you've got something like this, where do we go from there?
Yeah, so let me, maybe to answer that question, let me use as an example, the city that sort of links Dana and myself, Chicago, is where we both work, do a lot of our work. And so what you're looking at right now is, what I've called here the tale of 3 cities. I'll cram a very, very small history lesson here in the form of data. This is showing you the homicide rate for Chicago, LA, and New York over a really long period of time. I think today Chicago is often thought of as a city that is, known fairly or unfairly for its rate of violence. One thing that you can tell when you actually look at this figure is, for a long period of time, Chicago and New York and LA were actually pretty similar, at least in terms of their homicide rates. You'll notice, actually, as one interesting bit of historical trivia, if you look at this figure and you look at the 1930s, you see that Chicago pulled away from its peers for a period of time there. That basically coincides with Prohibition, and an earlier era where Chicago, rightly earned a reputation and some notoriety as a place with a lot of gang violence. But if you look on the right side of the graph, kind of closer to where we are today, you can see that the city has really pulled away from LA and New York. And when a lot of the work that I do is focused on trying to understand, using data and research, both why that is and how to change that, right? It doesn't seem like an inevitability that Chicago ought to have such a high rate of violence relative to cities like New York and Los Angeles. And so, just to give you 2 examples of how we can actually use data to try to get a handle on this problem. If you look at the next slide, this actually will show you rates of the homicide rate across those 3 cities, broken down into homicides due to guns and due to other means of death, so not non-firearm homicides. And what you'll notice when you look at this, I thought this picture was particularly stark when I first came across it, was the rate of homicide without a gun is actually not that different across the 3 cities. What really drives the enormous difference that you just saw in the previous graph is gun homicides, which should tell us something, right? It tells us that firearms play a really tremendous role in driving a lot of the public safety challenges that a city like Chicago faces. It causes us to think harder about what is it about LA and New York that accounts for this difference. Are they doing a better job of keeping guns off the street or preventing people from getting access to guns who would otherwise use them to harm someone? So that's sort of one concrete example of how we can use data, is to sort of focus our attention on where the problem is. And the other example I'll use, which is on the slide after this, is in 2016, for example, Chicago had a really, really terrible spike in homicides. It rose about 50% or 60% in 1 year. And when we were looking at the data to try to understand who were these victims of homicide, what was happening in the city, what sort of services are being provided that might help keep people safe, what we noticed was that the majority of victims, 87% of victims, were actually 18 and over, right? And the reason that's important is because a lot of the programming offered to reduce violence in Chicago and in other cities is programming that's geared towards youth. And it sort of identifies this kind of service gap that exists, right? Where a lot of, historically in the US, we provide a lot of services to children, to caregivers, to the elderly, to the disabled. We don't tend to provide a lot of services to adults who are not caregivers. And that group includes, for example, adult men with criminal records, many of whom are kind of right at the center of a problem like urban gun violence. So data can really help us kind of sharpen our focus and zero in on where we think we need to make important improvements.
Speaking of stark and sobering, if we go back a couple graphs here, one thing that I thought was interesting is the sustained amount of time in the Chicago, in this homicide rate here. That's a period of, how long are we looking at here?
A couple decades now.
Couple decades now, right? So you've been involved in this work presumably for a while. That's got to be discouraging and certainly take some perseverance to get through something like this. But that one just kind of stuck out at me because we're looking at 100+ years of history here and a big block of time there. I want to welcome the audience once again. I want to encourage your questions throughout. I just got a couple kicked my way, so thank you so much for that. I want to back up again and understand your work a little bit more. We've got an audience from all over the globe here, people who are working in this field, not working in this field, interested in this field. So I want to learn a little bit about what your particular skill sets are. What's required of this? What is your background? What is your education? What kind of person is suited to this work in your experience? Or what has actually served you well as far as skills and training and all that? Dana, let's go over you for this one.
Great. So I'll start by answering the question about kind of the personality characteristics. I think you have to be intellectually curious, of course, and patient. I think I also have a passion for making complicated things simpler. So for making things accessible to people so that all this sophisticated analysis can actually be used by people who aren't trained to be researchers. In terms of my background, I have a PhD actually in clinical psychology, but chose to specialize in policy. But I think probably the most instructive experience, and I've spent the last 20 years or so providing program evaluation and technical assistance and data analytics support to child welfare and juvenile justice systems. But I think one of the most instructive experiences was actually being an embedded researcher, so working within the Illinois Department of Children and Family Services, so the Illinois Child Welfare System, as a policy advisor to the director, because that really helped me bridge the gap between what you learn to do as a researcher, that is come up with ideal solutions, and bridge the gap between that and what is actually possible. And I often say to my data team, I have to remoralize them when they are disheartened by the fact that systems often can only adopt 15% of what we tell them to do based on the data. But that's still better than what they might have done had we not provided data analytics and evidence for the solutions that make the most sense. But having that real world experience really helped me to understand what system leaders need in order to make change.
Max, how does your experience and educational background either dovetail or contrast with Dana's here?
Oh, it totally complements what Dana just said. And actually, one of the things that I really love about this field is that, so my background, for example, I'm trained as an economist. Dana did social psychology. There are folks who do sociology, who do statistics, who do computer science. There's so many different backgrounds that provide people with tools that are very helpful for moving these issues forward. So when I think about what skills are really helpful here, it's not it's nothing unique to economics, which happens to be my training. What really, if you think about the title of this event, right? Data-driven policymaking. I mean, on the one hand, one key skill is right there in the name. It's data, not just data is something that policymakers are swimming in now, certainly compared to a generation ago. Right. But making sense of that data remains as challenging as ever. But a lot of different disciplines provide the kind of skills necessary to do that. And I'm not just talking about, statistical techniques for analyzing data, sure, but they're also, thinking about, for example, something more close to my work is, causal inference techniques for how to extract meaning from data. So very often, a policymaker will kind of approach me and say, we tried this policy over here. What impact did it have, right? Did it actually help keep people safer? Did it improve educational outcomes, et cetera? And that's not an easy question to answer. In fact, it's a very difficult one to answer. And so there's a whole host of techniques that are really helpful for answering that specific kind of question. But of course, not everything is a causal question. That's just a subset of things that we care about. I think maybe it's sort of at a higher level, the skill that's maybe most important for the work that I do is the kind of, it boils down to knowing which questions are answerable with what data and which ones are not, right? And knowing how to sort of help steer someone who's asking the question, to try to steer them towards something that we can actually answer and they can actually learn from and they can actually use to improve policy.
Beautiful. A couple things that I kind of took notes there, which is, Dana, you had mentioned that only 15% of your recommendations are adapted by policymakers.
That's not empirical finding, but yeah.
15% is high.
My suspicion.
Jeez. Okay. And you describe some of the stakeholders involved in the work that you do as policymakers. Who are we talking about? Who do you really work with? And when working with those people, what are your shared objectives? What is everyone working toward in your day-to-day?
So I tend to work with system leaders. So that could be the director of the state's juvenile justice system. It could be the director of the quality assurance unit. It could be anyone tasked with implementing a new initiative and trying to figure out where is the population that they need to serve or what's the best way to get it done. And in terms of the objectives, I mean, my objective is usually for these systems to behave more rationally. I think if I break that down, I think about rigorous implementation, so things that roll out in a way that where the intervention actually gets to the people. And I was thinking about this morning because I was trying to think of a concrete example that everyone can relate to. And I think the one that came to mind is the COVID vaccine. So like we did this incredible thing in developing these vaccines in an unprecedentedly short period of time. But everything hinges upon how the vaccine rollout is implemented. So you can have the best intervention in the world, but if you can't get it to people because the strategy is not aligned with where they are or doesn't provide clear instructions for how they get it or doesn't prioritize things in a way that people understand, then you may thwart the potential of that powerful intervention. So that's not obviously from my field, but it's from an example that I think all of us can relate to. So rigorous implementation, systems that behave more rational, and equitable access to things that everybody who needs the services, the supports, the resources can actually take advantage of them.
And do you count on some of the agencies and governmental organizations to actually make some of this public? Do the making public part of this kind of thing? I mean, is that how this kind of plays out?
You mean who's responsible for the actual implementation of this stuff?
Yeah.
Yes, we operate, I mean, kind of as consultants. I mean, we provide technical assistance. It depends on what systems need. I tend to think about what we do as capacity building. So our goal is not to always provide the data analytics support, but to train people to think like researchers within these systems so that the next time they have a big policy question, instead of just pulling something off the shelf, they go to the data and say, well, what do we need to know in order to know which intervention or where to put it? So we try to build capacity to do that. And every system is at a different developmental stage. Some systems can take that and run with it, and others need our help for longer.
Yeah, and Max, is that your experience? Kind of the same way, the relationship between all the parties?
Yeah, it is, and I just want to build on a couple of things that Dana said. So one is maybe at a higher level. If you're trying to make a dent in a really thorny, seemingly intractable social problem, like let's say gun violence in my case, there are a lot of organizations, a lot of entities that are working on this, right? There's a lot of nonprofits, there's a lot of community organizations doing amazing work to try to improve people's lives. But at the end of the day, I think if you really want to make impact at scale, if you really want to make a huge dent in this, you have to harness the power of government, right? Government has the resources to really shift in a meaningful way a lot of these issues, but that means convincing folks in government to make policy on the basis of evidence and data, which look doesn't always happen. We wish it did, but it doesn't always happen. But you can try to steer policymakers in that direction by providing them with evidence that's actionable, that speaks to a core problem that they have. So the sort of overarching theory of change, if you will, is work closely with policymakers, provide them with evidence and data. And as Dana mentioned, I want to emphasize this point because I can't agree with it enough. Not only just provide them with evidence sort of when they need it, but teach them how to actually think this way, because this is kind of teach a man to fish sort of moment, right? And maybe this is educator in me. It's just that I think you make a lot more progress in the long run by changing how people actually think about these challenges, not just by providing them in the moment with an answer to the question that they happen to have, although that's also very helpful, but really by making them appreciate, for example, the importance of rigorous evidence of how to ask and answer the right questions. So whenever I can do that, if that's ever a possibility in my work, I'm always happy to do that, because I think it pays dividends in the long run.
Yeah, thank you. Timely question coming in from viewer Joshua, who asks, policies are typically reactionary due to data showing the expressed need for said policy. Is it possible to use predictive analytics to actually develop preventive policy instead of reactionary? Any thoughts on that? That is truly a jump ball. Anybody, either of you can take that one.
I mean, I can start, Max, if you're comfortable.
Yeah.
So yes, we have our systems the systems we're talking about have accumulated decades and decades of data that we can leverage to do some pretty powerful things, including develop predictive models that help us to inform policies that are preemptive, as this participant mentions. There are risks involved with that too, and it requires really it's a big responsibility to use those data in a way that is ethically sound, given that there's so much systemic bias embedded in that historical data. But we do try to function in that way. Although I want to validate what you're saying. The metaphor I often use is that I wish we could train people to be more like seismologists, the people who monitor the ocean floor to tell us when the next earthquake is happening, as opposed to firefighters who are always redirecting this fire hose to the problem that's right in front of them. We have enough trend data to be able to anticipate, just by shifts in trends, to be able to know when things are going in the wrong direction. It doesn't actually take something as powerful as predictive analytics. We can do some simpler trend analysis to develop triggers so that we can let systems know when there's an earthquake that's about to happen, or the analog in child welfare, juvenile justice, or gun violence.
Mm-hmm. Go ahead, Max. Looks like you can follow up.
Yeah, just to add on to this, I think some of certainly a lot of policymaking does seem to be just running around from fire to fire, putting them out. But other things, I would say, just to take again a public safety example, I can tell you that with pretty high confidence, tragically, that on any given weekend in the summer in Chicago, you're going to have far too many people shot, some killed, in a handful of neighborhoods. This has been true for year after year after year. You don't really need fancy predictive modeling to tell you that is a problem that is likely to happen. For those kinds of challenges, I think that the issue is, what do you do about it, right? What is the actual intervention? What do you do differently? And there's a if it were an easy problem, we would have solved it by now. So there's one sort of challenge in doing that, but that's not to say that the kind of predictive analytical work that the question asked isn't helpful. It certainly is. Some of the work that I'm doing, for example, is designing interventions to reduce gun violence that work with specific individuals, and very often the kind of individuals who are most at risk for involvement in gun violence are not the kinds of people who will kind of show up to ask for help, right? They are individuals who are mostly disconnected, let's say, from a lot of social services. Their primary contact with kind of the system writ large is often the criminal justice system, is when they come in contact with police or jails. So finding a way to help those people, their predictive analytics can actually be extremely helpful, because it can really narrow down the focus of, let's say, community organizations doing a lot of important social service work, to tell them, here's exactly who you need to focus on, because these are the people who are most at risk of being harmed, in a gun violence incident in the future. So I think there's definitely a role to play there. It has to be done very carefully and dealing with a lot of the ethical issues that Dana pointed out. But we actually have some interesting work that might help shed some light on that.
Mm-hmm. Good. Thank you for that answer, and good question from Joshua. So we are a year into the pandemic. We're at about the anniversary time. What has the impact been over this past year on the fields in which both of you work? Max, I think I'll start with you on that one.
Yeah, sure. So if we actually turn to slide 5, I'm going to give you just a high level overview, if you will, of kind of where things stand right now. So this is actually data from Chicago, again, just to stick with the theme of Chicago data for the time being, showing the deaths that occurred in the city over the last couple of years, including last year in 2020. I mean, the picture is obviously jarring for a variety of reasons. And most of that increase that you're seeing in this graph, sort of natural causes of death, a lot of those deaths are in fact COVID deaths. So COVID has been absolutely devastating for Chicago and for a host of other cities. But in addition to the kind of very obvious challenge posed by COVID, there's some sort of maybe less immediately obvious challenges created by this past year. So if you look at the same graph, if you sort of look beyond the bottom part of the bar, which includes all the COVID deaths, if you look up at homicide, that little red slice, right? It went from 532 last year to almost 800 this past year. So in a single year, homicides increased by almost 50%. And that is, in any other year where there wasn't a pandemic happening, that would be the only thing that people would be talking about in a city like Chicago, is how homicides could possibly increase by 50%. And if we think about what might have happened last year that would have caused this, I think there's sort of two factors that come to mind. One is COVID itself, right? It has been an enormously stressful stress factor on young people, who are the ones who are disproportionately involved in violence. I think we've been understandably focused a lot on the elderly because they have borne the brunt of COVID, but young people have been suffering just tremendous mental health strain due to the pandemic. Young people's unemployment rates have skyrocketed. Young people dealing with substance abuse and thoughts of suicide have gone way up. So there's a huge strain being placed on young people. In addition to that, like everybody else, every industry has been affected by COVID and has to change the way they work. So a lot of the sort of tools and mechanisms that society has in place to try to deal with, let's say, public safety and violence haven't been working as effectively as they normally would because of the pandemic. Whether it's your after-school mentorship program or your violence interrupters or the police, any one of these entities has had to change the way they work and cut back in a variety of ways because of COVID. So all of that has been sort of less effective than it would otherwise be. And then, you have to mention not just COVID, but there was the other noteworthy feature of 2020 was the enormous amount of social unrest following the death of George Floyd, and all the protests and anger directed at police and local governments about racial equity issues. And it's hard to know exactly what role that played, in the increase in violence that we saw. I would just say that, for example, if you take the police as one case study, whether or not you think police are effective or not effective, it is almost certainly has to be true that police are less effective when they do not have the consent of the communities that they police, when they don't have the cooperation of the neighborhoods they police. And it seems almost impossible to imagine that after the events of last year, that trust in the police has not eroded substantially across a variety of cities. And so this increase that we're seeing here in Chicago in homicides, we saw that in New York, we saw that in Los Angeles, we saw that in a whole host of other cities. And so COVID is really, COVID combined with the social unrest has really just placed a tremendous amount of strain on cities and really exacerbated, I think, the public safety challenges that they face.
Dana Weiner, in our conversations prior to today's event, you had highlighted a few opportunities that have emerged, or at least some unanticipated directions that your work has taken you. Can you tell us about a few of those?
Yeah, absolutely. So, yes, this last year has seen incredible disruption to all of these systems, but with that disruption has come tremendous opportunity to learn new things, to study things that were not observable before, and also to see these systems change. So I'll dig in with an example in a second, but I think both Max and I have worked in and around these big bureaucracies for long enough to be a little bit cynical about how long it takes to actually change things and implement things. But what we saw with the pandemic was that these systems had to change overnight. They had to come up with new ways to stay connected to people and engage with families and deliver services. And that mental flexibility that we were all forced to deploy in the face of this tremendous challenge can now be leveraged to say, hey, you're making these changes. Well, if you're going to make them, let's figure out the best way to do it, or the people who need these cash payments, or what the impact of those cash payments is. So I'll go back to, to my first point about we were able to learn some things that we might not have otherwise learned with a story. So early in the pandemic, when schools shut down, what we heard from a number of child welfare system directors was our hotline, the child abuse neglect hotline reports have gone way down. They're down by like 40, 60%, 80% in some places, because kids are not in school and teachers are not reporting child abuse and neglect. So what are we going to do about all this stuff that isn't getting reported? And when kids go back to school, because early on we thought kids were going to go back to school soon. When kids go back to school, how are we ever going to catch up? There's going to be a flood of new child abuse and neglect reports. And that didn't sound right to us, knowing what we know about the data. So what we did was we dug in, actually using the NCANS data, the National Child Abuse and Neglect Data System, which is administered by Cornell University. So we use the NCANS data to try to understand the relationship between the role that teachers play in reporting child abuse and neglect. And the slide that you're looking at now is a breakdown by the type of reporter. So indeed, school personnel, teachers and other people who work in schools are responsible for the largest single chunk of child abuse hotline calls. 20% of hotline calls come from school personnel. And that's the reason why the reports plummeted during that period of shutdown. But the important thing that we learned, that I don't think, had we not looked at it in this way, we wouldn't have realized, is that only 10% of what teachers report is ever substantiated as child abuse and neglect. So teachers are calling in a lot of other things, many of things that we now understand to be secondary to poverty, that are not actually abuse and neglect, but the child welfare hotline, it has become the only place where they can do something about the things that they're seeing. But that also helped us to understand that the reduction in reports that was coming from teachers not reporting was not likely to lead to missing a lot of true cases of child abuse and neglect. And so if you go to the next slide, I'll just tell you the rest of the story. We also looked to the history to see, well, will there be a flood of cases? In fact, the initial metaphor we used was, is it like an accident on the highway where all those cars still have to get where they're going? Or will there be some other pattern for all these unobserved incidents? And what we saw when we looked at the historical data is, indeed, every summer there is a drastic reduction in calls to child abuse and neglect hotlines because kids are not in school. And when kids go back to school in the fall, there's no catch up. The rate of calls returns to what the baseline was, but it doesn't overcompensate for the calls that were missed during the summer. And then if you just go to the third slide there, you can see, and this also helped us to allay some of these concerns, that the fluctuation that we see is among those unsubstantiated calls for child abuse and neglect. So the calls that go away are those that don't ever result in an actual documented case of abuse or neglect, which and all of that is to say, it's not that we shouldn't be concerned about what families are experiencing during the pandemic, because we also did a lot of other analyses to understand the relationship between financial instability and unemployment and child abuse, and there is a real relationship there and there is real risk. What this means is we shouldn't be concerned about teachers not reporting. The answer to the problem isn't, let's make sure we get those teachers to call in more incidents of child abuse and neglect, because for the most part, they're not very sensitive reporters.
You had also mentioned when we were chatting right before the show here about new opportunities to study things that were previously kind of unobservable, is the way you kind of put it. Tell me more about that.
Yeah, so again, this disruption created some tensions that for which we developed solutions that now we can study. So, for example, it used to be that diversion strategies, so that is providing services to youth who get arrested for offenses, that those diversion strategies were only offered to kids with very minor offenses. The law says that you can only detain kids for a certain amount of time prior to a trial or hearing taking place. But courts shut down also. So kids with all kinds of offenses were being detained for longer than the law allows because hearings weren't happening. So in response to that, the Cook County State's Attorney offered diversion to another group of kids who wouldn't have been eligible for those strategies prior to the pandemic. And now we're able to study the effectiveness of diversion strategies in a whole different population that previously was not eligible for those. So we're accumulating knowledge about these other scenarios that just, the situations weren't even there for us to learn from before.
And what about the ripple effect more broadly? Is there more appetite for change? There's momentum going on behind a lot of movements for reform and so on. What have you observed in that kind of space? People are having to deliver in a more nimble, timely way because things are so urgent.
Yeah, and I think that agility, and as I mentioned, earlier, the kind of mental flexibility and creativity that has fueled some innovations. We've seen child welfare systems repurpose school buses that are not taking kids to school to deliver meals. We've seen other ways of, reaching out to families, and all of these, as a researcher, all of these are new things that we can then evaluate and see, well, how did that work? How many people got more food because of that, and how many, how did the functioning of families change in response?
Right, and for Max, in your observation or estimation, how have some of these approaches to that, have they yielded new data? Is there new evidence, new directions for research that is informing your work? What's going on with that?
Yeah, it's very similar to what Dana mentioned about agencies and organizations having to respond really quickly in a really unusual and unprecedented circumstance does create the possibility to learn things that we might not have otherwise learned. It creates kind of a conditions for like a natural experiment. So when I think back to especially the early days of the pandemic back in March and April of last year, a lot of criminal justice systems were scrambling because they had, for example, jail populations that they wanted to rapidly bring down because of the risk of COVID spreading within facilities. This is not an entirely new motivation. For years now, there's been a lot of pressure being applied to policymakers to try to reduce jail populations as part of a broader sort of policy objective. But this suddenly accelerated it rapidly, right, faster than anybody could have ever anticipated. We saw, for example, jail populations plummet in a lot of cities very, very rapidly, which again creates an opportunity to try to understand, how exactly, what are the implications on public safety from this? What can we learn from this? So that even once the pandemic is over, we don't necessarily have to go back to the status quo that existed, back in February of last year, right? What can we actually learn about how to do this safely? How to do, for example, remote monitoring and things like that in a way that can sort of meet the policy objectives that mayors and prosecutors and sheriffs and all these other agencies have, while at the same time doing this in a much more humane and sensible way than maybe the way that they had been doing it before. That's sort of one concrete kind of policy type opportunity to learn new things. Another thing I'll just mention on the sort of on the racial equity and justice component of what happened last year is I think that a lot of focus in the past for example for research on, let's say, criminal justice or policing has been what has been the impact of these efforts on crime and public safety, which is a sensible way to start, but it misses a big chunk of the actual question, because we know that police, in addition to potentially helping to keep communities safe, also could potentially introduce harms to communities, right? We know that police, through actions like stop and frisk, through patrol, use of force, et cetera, all these things have a potentially damaging impact on some of the same communities that they serve. And so it's sort of, I think, sharpened our focus and made it much clearer to researchers that what we need to be doing going forward is not just focusing on the things that are somewhat easier to measure, right? Things like what happened what happened to homicides, what happened to violent crimes, but also on making sure that we invest just as much time and effort into measuring the things that are traditionally been harder to measure. What is the effect on community sentiment, right? From having police, more police in a neighborhood, or police trying tactic X or tactic Y. Mm-hmm. So these are the sort of things that I think, coming out of 2020, thinking about what lies ahead, I think that's going to really change the way that we approach things. We're going to have opportunities to learn things based on what transpired in 2020, all the kind of natural experiments that we were forced to conduct because of COVID. And then on top of that, I think just a greater awareness of needing to measure things and study things and ask questions in a different way to try to get at some of these racial justice concerns that are extremely important and really just pervade this work.
Dana, did you want to add anything to that? I saw you nodding over there. Yeah.
Yeah, that last piece, around the role of the turbulence in this year that has forced everyone's attention to disparities that we've always documented, but now I think even as data analysts, there's an imperative to collect and look at data in a way that illuminates those disparities at every turn. So, doing things like disaggregating racial ethnic groups when looking at, so even that map I showed in the very beginning, if I were to make that map today, I would make that map to understand how different racial minorities had access to those trauma services. It wouldn't just be all kids. I would break it out so I could see, well, are there disparities in who is near a trauma, an evidence-based provider of a trauma service? So I think that's an opportunity also to have kind of galvanized support for examining disparities in a way that that maybe was not the main focus before.
Mm-hmm. I have a good question from viewer Linda. I think it's a good time to kind of bring this in because I'm curious about it as well. Linda asks, how do you combat the systemic racism that biases so much existing data before you even try to predict? So let's talk about the data integrity as it relates to systemic or implicit bias. Yeah,
and it's a really important question and something that I've written about as well. So one of the things that there are a number of things that we do. Number one, we try to build a robust oversight and kind of governance structure that has representation from all of the groups that will be impacted by whatever analysis we're doing, so that we have stakeholders to help us understand what the data mean and what we should do about what the data tell us. I think there are some more kind of granular strategies that we deploy, particularly if we're using historical data to predict the future. One of the potential pitfalls is that if we use data on how systems have previously responded to people to predict what will happen next, we're kind of embedding and potentially amplifying the bias in those systems. So for example, if we use previous arrests to predict future arrests, but we know that there are racial disparities, or if we use, in the child welfare example, previous placements in congregate care or something else in which there's a lot of disparity, if we use those as predictors, then we run the risk of creating, creating predictions that are going to just amplify that bias. Mm-hmm. I think we have options for what to do with that. I think sometimes if we can analyze the role of those factors and then remove them from the algorithms that we use to generate an assessment of risk, we can potentially use those to correct for racial bias in decision making. But that, like I said, requires a lot of trust and partnership with communities and stakeholders to ensure that we're not kind of going off of the data and doing something that doesn't resonate and speak to the population that it's meant to help.
Speaking of forecasting, there's an approach that you're taking to forecasting that we wanted to share a tool and a visual with that as well. So let's show that. Tell me a little bit about what we're looking at here in this slide here, forecasting latent demand.
Yeah, so going back to that story about child welfare directors who were worried that there was going to be this deluge of cases that they weren't going to be able to respond to. And I showed you some of the things that we learned about that made us feel a little bit less concerned that there was going to be a flood of cases. However, we were also aware of what happens to families in the face of crisis, and we were aware of the tremendous financial upheaval that the pandemic meant for a lot of families. And so we did feel like we had to provide some kind of guidance to child welfare system leaders to tell them what was likely happening that they weren't seeing. So if they wanted to devise strategies to reach out to families, they would know how to right size those to the unseen or latent events that might be going on. So our team at Chapin Hall developed what we called this latent demand simulator, which was basically meant to take years and years of historical data understand the relationships between all of these factors, like poverty and unemployment, and using the fluctuation that's happening now in those factors, forecast how much abuse and neglect might be happening that isn't getting reported. So this graphic that you're looking at, the gray line is the average number of events that got screened in, reports that got screened in at the hotline. The orange line that plummets at the beginning of the pandemic is those reports going down. Mm-hmm. And the blue line is what we think might have been happening actually that wasn't being seen. So you can see the lines come back together. The blue line comes back down when families received stimulus checks. But another thing that we learned in this is that unemployment is the single biggest predictor. This has the strongest statistical relationship with the fluctuating rates of child abuse. So this provided more knowledge for the field, but also provided a way for system planners to think about, well, if we are going to staff up or develop another strategy to reach these families, how many families are we talking about?
Mm-hmm. I'm going to throw a curveball. I didn't tell you about this one, but I am curious how AI figures into all of this. I'm sure some of our audience members and viewers have thought about this. How does this play into your world, if at all, currently? What's the deal?
I'm happy to take a stab at this one. So it factors in a couple of ways, but let me give you one concrete example of a project that I'm working on that has an AI or machine learning component, which is, I mentioned earlier that to the earlier question that I think Joshua asked about predictive analytics and their role in preventing some of these issues. We have actually developed, for example, a predictive model of someone's likelihood of being involved in an incident of gun violence, specifically to try to direct social services. I think that one of the things that gets brought up a lot, and Dana touched on this as well as the questioner, is that there's this concern about using biased data, let's say arrest data, for example, biased data to try to predict a biased outcome like future arrest, and creating this kind of negative feedback loop where we sort of exacerbate historical harms, right? We kind of guide, let's say, law enforcement to the people and the places that they've already maybe disproportionately been focused on, and it just kind of repeats itself over and over again. I think that one of the ways in which you can try to sort of break that loop a little bit is to think about how can we use these data, biased though they may be, they're the data that we have, to try to actually help populations. So if you can use, for example, arrest data, use biased arrest data to try to predict who might be at highest risk for not necessarily being arrested for a violent crime, but being the victim of a violent crime, which we can actually measure fairly precisely for some types of violent crime, like, for example, shootings. We know virtually everybody in Chicago who is the victim of a fatal or non-fatal shooting, and we can use that information to try to predict who in the future might be a victim of a shooting, and not direct law enforcement towards them, but direct social services towards them, right? Try to have, whether it's a social worker or an outreach worker, someone who can provide an offer of help and support to that individual so that they can try to reduce their risk of being a victim of gun violence in the future. So that's one concrete example of how we're actually using AI. It's not a theoretical thing, we're actually doing it today to try to do this. But I think there are a lot of challenges and pitfalls to doing this well, and Dana touched on some of them. I think transparency is a really, really important piece to this because there's a lot of apprehension, and for good reason, with how these things are used, and it's very, very easy to misuse them. And so it's super important that we be absolutely clear and have the buy-in and understanding of the communities that we're working in order to actually use these things responsibly. Mm-hmm.
Beautiful. You had mentioned, one thing that I wanted to make sure we kind of touched on, because I think this is really important and kind of a revelation in a way, was that the dynamics of intervention have actually changed with COVID. So what can you tell us a little bit about that? How is that playing out in real time, Dana?
Yeah, I mean, again, it's more for us to study. So at the start, just before the pandemic started, we were kicking off a project where we're the evaluators on an adaptation of an intervention called multisystemic therapy. It's intended for, this particular version is multisystemic therapy for emerging adults. It's intended for kids who are coming out of the juvenile justice system and reintegrating into the community, but they're at an age where they need some mentoring and guidance to have independent living skills to function productively as they leave the juvenile justice context. And we were supposed to evaluate this adaptation that already had an evidence base. Well, when the pandemic hit, it could only be delivered remotely, and there are no instances of this having been implemented or evaluated through a virtual connection. It was always meant to be, you're spending time together in the community, going to places. So we had to pivot and kind of change what we had proposed to do, both to come up with ways to understand like the feasibility of delivering this intervention in a remote context, but also to ask a whole different set of questions, because then we needed to know, well, we had to insert questions into this evaluation that had to do with like, what are the barriers and facilitators of kids being able to engage in a therapeutic connection remotely? Do they need privacy? Do they have the technology they need? Do they feel as comfortable tackling some of those difficult issues? So we've asked a different set of questions. We've used a different set of strategies, and the thing we're evaluating is actually a remote adaptation. It's a completely different thing than the treatment that we thought we were going to evaluate. Well, we're hoping it will yield something, interesting. I think as we're now at the year anniversary, a lot of us are thinking about, well, what do we want to hold on to from these adaptations? Do I really need to fly to LA for a 2-hour meeting, or should I not be doing that in the future? And should we, some of these things we're going to change the way we do things, and this intervention could be one of them. We'll see.
Yeah, that's interesting how it happens across disciplines and fields and industries. We all have found better ways of doing things and are definitely kind of, cutting loose the things that have held us back in the past. So I hope that turns out for the better. So let's talk about some of the challenges you face in your work. We've already heard about many, but what are some of the particular things that kind of stand out with some of the work that you do? Max, let's start with you there.
Sure. I can think of at least two major challenges. One that I kind of touched on a little bit earlier is sort of a methodological challenge, which is a lot of times, policymakers have to act quickly, right? There's urgency to do something to address some problem, and so they act. And then after the fact, they want to know, was what I did effective? Because I might have to do it again. And methodologically, that poses a challenge, because oftentimes, the way in which you carry out a policy can really affect how likely you're going to be able to learn whether that policy was effective down the road. And most policymakers, for understandable reasons, are really just interested in expediency, because they have to fix what's in front of them right now, and not so interested in their future selves wanting to know the answer to this question. So one thing that's just always a challenge is trying to work with policymakers to anticipate what might be the challenge, what might be the thing that they're going to have to do in 5 or 6 months, and tell them, well, look, if you're going to be doing that, can you do it this way? Because if you do it this way, you might be able to actually learn something about it afterwards. Whereas if you just do it the way that's easiest and take the path of least resistance, you're going to be shortchanging your future self. So that's one thing. And then kind of a related point is, part of the reason why policymakers, I think, run around from fire to fire putting them out is because there's a real limited capacity for policymaking, especially in local and state governments. When I started working in Chicago a couple of years ago, there was, I want to say maybe one and a half people in the mayor's office in Chicago whose sole responsibility was focusing on public safety for a city like Chicago, a city that has for years had the reputation of dealing with violence. Mm-hmm. In contrast, for example, in New York City, it's a bigger city, but not, it had something like 50 or 60 or more people in an office within the mayor's office just focused on violence and gun violence specifically. So, an enormous disparity there. Chicago's gotten better in this regard. They've staffed up in this capacity, but I don't think Chicago is unique in this respect, right? There's a lot of cities where if you go, if you really dig in, you go to the mayor's office, there's people who wear multiple hats who are trying to deal with 5 different things. And they often just don't have the bandwidth to try to do long-term planning, to try to lay the groundwork to be able to answer questions down the road. And so, that's where, as a researcher, we try to be helpful. We try to augment that capacity by doing some of the thinking with them and for them to help them. But it would be, if I could wave a magic wand and sort of fix one particular challenge about this work, is that it would be sort of to have more talented policy analysts, you know, of the kind, for example, that are, you know, being trained here at PAM at Cornell, go work in these mayor's offices and state houses and so forth, to try to really give them the tools to actually be able to do more of this long-term planning.
You know, Dana, that 15% adaptation rate has stuck with me through the hour. I can't kind of let that one go. But, you know, you had mentioned, well, there's a lot of turnover in government, municipal, state, federal, or otherwise, quite often, by design, frankly. Mm-hmm. And so how does that present issues for you, challenges with continuity, working with the same people, staying focused over long term?
Yeah, it's really challenging to sustain momentum on initiatives when one leader is really committed to them and the next is committed to another set of things.
Right.
You know, I was thinking though about what Max was saying a few minutes ago, you know, and how we're sometimes hindered by we don't necessarily, when researchers come to the table later in the discussion, we don't always have the foundation or the data that we need to answer questions. And I was thinking of the role that researchers play in this partnership, because sometimes the research partner can serve as the continuous thread, you know, between administrations. Sometimes if those partnerships are enduring, we can provide some of that continuity. But you know, it also made me think, Max, just about how much easier it is to provide productive, informative analytics when we're there at the beginning, when things are initially conceived of, and we can say, okay, if you're going to do this, here are the 7 things we should be monitoring so that we know how they looked in the beginning and we know how they look 2 years down the road. When we're there at the start, we can do that. When we inherit these questions or we come later to the research party, so to speak, you know, sometimes the limitations in what the data can tell us are just, you know, make it very difficult for us to actually be able to measure things with rigor.
And there you have it. We've almost eaten up an entire hour. Who could have predicted that? So there's a couple resources I want to share here. Maybe you can set the table for us, Dana. What's this Chapin Hall COVID-19 and child welfare thing? We're going to have the eCornell team share this URL. What is this resource? How can it benefit our audience?
That's the rest of the story about what we've been doing this year to try to help child welfare systems adapt to the changing dynamics of reports being down and kids being out of school. That brief walks you through what we did, but it also calls for a set of system adaptations, ways in which we think systems can change the way they're delivering services to people in response to what we've learned. For example, partnering across human service systems. Child wealth, what we're seeing and what we realized after looking at the data on the school reports is that child welfare has become kind of the de facto safety net, and that there are other agencies that have resources to meet the needs of families related to poverty, and there needs to be more robust partnerships between those agencies. So you'll see that in the brief.
Perfect. Thank you. We have a couple other resources to share really quickly. We're going to share a YouTube video of you at the 2016 Chicago Humanities Festival. This particular video is about applying analytics and evidence to policy. Again, further fleshes out our conversation. So eCornell team, share that one, please. And again, we have the data science certificate programs. I had a number of, first of all, I should say that a lot of the viewer questions were amazing. Thank you so much. You really kind of set us up and took us in some great directions. There were several questions also about education. How do I learn more about this? Let's share the URL to Cornell's data science certificate programs as well in the URL. Again, thank you everybody for joining us. Max Kapoust and Dana Weiner, an absolute pleasure. It's been lovely working with you. Thank you so much.
Thanks so much, Chris.
All right, and audience, thank you so much. Remember, this was live. The recording will be available in just a few minutes. I appreciate all of you, and thank you so much for joining us. Stay strong, stay safe, and we'll see you at the next keynote. Thank you so much. Bye-bye.